District. Tonight, I would like to introduce our panelists. First, I'd like to introduce our translators. First, we have Anna, who's going to be our translator in Armenian. Sorry, Anna, sorry.
Բարև ձեզ, ես Անա Արզումանյանն եմ, մեր շրջանի հայոց լեզվի թարգմանիչը, եթե այսօր ձեզ թարգմանություն է հարկավոր, խնդրում եք նայեք ձեր էկրանների վրայի գլոբուսի նշանը եւ այնտեղից ընտրեք հայերենը, եթե հայերենը չկա, այդ տարբերակը չկա, խնդրում եմ ընտրեք ռուսերենը, որովհետեւ տարբերություն չկա, այն կլսեք նաեւ հայոց լեզվով։ Եվ եթե հարցեր ունեք, կարող եք նաեւ հայոց լեզվով գրել Q&A բաժնում Եվ ձեր հարցերին կաշխատենք պատասխանել այսօր կամ էլ հաղորդումից հետո։ Շնորհակալություն. Back to you, Dr. Hill.
Thank you. Next, we'd like to introduce our Spanish translator, Nuria. Ms. Lundberg, we can't hear you. Double check your sound. Not yet.
¿Hello?
Now we can, yes.
Buenas noches, yo soy Nuria Lundberg, voy a ser su intérprete esta noche. Y bueno, nuestro superintendente Matt Hill nos está introduciendo y dando la bienvenida a este webinar. Para poder llegar a nuestra sala, ustedes van a ver el mundo color gris en la parte inferior derecha de su pantalla. Y van a ver los diferentes idiomas, entonces presione donde diga español. Y bueno, ustedes van a ver también donde dice QIA, que ustedes pongan todas sus preguntas y en la medida de lo posible vamos a poder contestárselas esta noche. Y bueno, muchas gracias, espero que les guste nuestra interpretación. Back to you, Dr. Hill.
Thank you. Well, thank you all. Okay. Thank you. And you will see at the bottom the interpretation button if you need to go into the Armenian or the Spanish room. So please click on those and then you will hear the translation. For the presenters, we're going to try to speak slowly so that our translators can translate for our audience. I want to thank everyone here. I see we have over 160 participants, so thank you this evening. Again, my name is Dr. Matt Hill, Superintendent of Burbank Unified School District. This evening, we have a great panel. We're going to focus on Dr. Morrison from LA County Department of Public Health, but we also have Lenora Aguilera, who is our head nurse here at Burbank Unified, as well as Stacy Cashman, Director of Student Services in the district. This evening's presentation is going to focus on information about the vaccine. I want to thank everyone for questions that they submitted in advance. I do want to address that many questions were about student mandate of vaccines. I want to be very clear, Burbank Unified School District does not have a student mandate on vaccines. What we will be doing is following the state mandate that the governor has announced. And that mandate, the earliest it would start to take effect would be next school year, July 1st. So tonight, we will not be talking about student vaccine mandates. What we will be doing is talking about the vaccine in itself. There's questions about the science behind the vaccines, side effects, where you can get it. So Dr. Morrison will be providing information about the vaccine so that you may make an informed decision for yourself if you haven't been vaccinated and your children. I also want to highlight there's been some information. We have set up 2 clinics where students can get vaccinated. This is optional. It will be on BUSD campuses. There's many places you can receive the vaccine, but we want to make it as easy as possible. So please check your emails for that. Again, those are optional clinics, and you will have more information as you register for that vaccine clinic if you would like to participate. With that, I would like to introduce Dr. Morrison and let her have the microphone. Thank you.
Thank you so much. Thank you for having me. I'm very excited to see so many people here, and I am going to give a presentation and then hopefully we'll have lots of times for questions. As Dr. Hill mentioned, I'll start with the questions that came in beforehand, and then I will move to the Q&A. Here are my slides. All right. So good evening. My name is Janina Morrison. I am a physician with the LA County Health Department. I'm also a primary care provider. I see patients at the General Hospital, LAC USC Medical Center. And just in case it's important to you and my credentials tonight, I'm also the mother of a 5-year-old and a 9-year-old. So I too am considering the evidence and making the decision about vaccinating kids in this age group. So these are the topics I'm going to cover really quick, go over some of the general vaccine basics that includes adults, and then really focus on the evidence we have for what we know about how does COVID-19 actually affect children in this age group, why would we think that they need to be vaccinated, and then specific evidence we have on how safe is the vaccine and how well does it work. If we have time, I'll have a little bit of information later about the boosters, because the boosters I think are kind of confusing. So if you have questions, you can ask about the boosters. And then you'll get information from Burbank on how to get vaccinated through your school district, but also I have links on all the different ways you can choose to get vaccinated in LA County. So I'm sure many of you know this. We have 3 excellent vaccines for COVID that are available for adults right now. We know the vaccines are very good at preventing us from getting sick, missing work, ending up in the hospital. For those of us who are older and at risk for complications from COVID, the vaccines protect us from dying. So the vaccines are now available for ages 5 and up. And there are, as you'll see later, there are many different ways you can get you and anyone in your family vaccinated. So just briefly, these are the 3 vaccines that we have for adults. We have the Pfizer. This is the one that has been fully approved by the FDA for ages 16 and up. It has emergency authorization for ages 12 to 15. And then I'll talk about the child dose that's just come out. The Pfizer is 2 doses, 21 days apart. The Moderna, which is a similar form of vaccine, it's an mRNA vaccine, is approved for ages 18 and up, and it's 2 doses, 28 days apart. And then we have the Johnson & Johnson vaccine, which is just 1 dose. And that's a slightly different kind of vaccine that uses DNA in a viral vector. So that's the basics. Now, we've all been hearing about vaccines for almost a year for adults, but it's a totally different question. We're thinking about our kids. We're very protective of our kids. We don't want to do anything to harm them. And so let's talk a little bit about what we've learned about how COVID actually affects kids. So since the beginning of the pandemic, we have seen nearly 2 million cases. This is in the United States, 2 million cases of COVID-19 infection in children. That's resulted in 8,300 hospitalizations. One of the complications, which I am going to talk a little bit about in detail, is a condition called multi-inflammatory syndrome in children. This is a condition that occurs about a month or 2 after a child gets COVID, and can even occur if a child has a mild case of COVID. And it involves generalized inflammation and is actually quite dangerous. So in children ages 5 to 11, we have seen more than 2,000 cases of MIS-C, most of which actually have resulted in hospitalization. And unfortunately, throughout the United States, children 5 to 11, we've had 94 deaths from COVID. So here's a little local data. So you can see these are cases among children in Los Angeles County, going all the way back to the beginning of the pandemic. In the middle of the screen, you'll see that big winter surge where everybody got lots of COVID. And you could see we had a surge just the same as we had in adults, we saw it in children. Whenever we have lots of COVID in the community, the numbers go up in kids. And the more kids who get infected, the more kids who are in the hospital, and the more kids who end up, unfortunately, in the intensive care unit. One thing I do want to highlight, as the mother of 2 elementary age kids, I've been super excited that my kids are back in school. They're doing so much better now that they're in school. But it is a little nerve-wracking, and we have seen this fall more cases of COVID in children because the children are back in school. So it's just something to be aware of. Here we go. These are the exact numbers for LA County as of last couple weeks ago. So in 5 to 11-year-olds, we've had almost 80,000 cases of COVID. Nearly 400 children have been hospitalized and 1 child has died. So here's just a little information again about those death rates for the whole United States. So you can see there's a graph here that shows the 94 deaths that were spread out among 5 to 11-year-olds. So obviously, compared to what we've seen among older adults and even young adults, this is a small number. But young children are generally so healthy that even this small number of deaths makes COVID in the top 10 killers of children last year. So it is definitely considered a serious risk for children, and is a higher risk than many of the other things that we vaccinate our kids for. So here's a little more information about the multi-inflammatory syndrome in children, which we call MIS-C. So we've seen more than 5,000 cases. It's actually the most common in this age group. The most common age is 9-year-olds. And many of these kids are hospitalized. And we've also had 9 deaths throughout the United States from kids who suffered from MIS-C. This is quite a serious condition, can have long-standing effects. One of the risks we'll talk about later is for heart inflammation. And in fact, kids who get this condition are very likely to have heart inflammation, and it doesn't necessarily go away quickly and can have some even permanent effects. The other thing I want to highlight is that unfortunately, this condition does affect children who don't have underlying health conditions. So about 50% of the children who we know were in the hospital with this condition had no underlying health conditions. Also, we're learning that children can get what's called long COVID as well, which means that the symptoms from COVID go on for more than 3 months. We don't have a lot of data on this, but it seems like maybe 7 or 8% of kids continue to have symptoms. And the symptoms can be very disruptive for their ability to participate in school and enjoy the activities they like. So we're very concerned about the risk of long COVID. And then just taking a step back for a second, overall, what have the effects of COVID-19 been on kids? I think one of the biggest problems has been school disruption. And we know that our kids have really suffered. They've suffered psychologically, they suffered academically, they haven't been as active. So here you can see this is just this school year. We've had more than 1.2 million children who've missed school because of COVID cases in their classroom. Obviously, this number was a lot higher last year when many of our schools were closed for most of the year. And then finally, let's just think a little bit about the indirect impacts of COVID-19 on children. So there's mental health, which I've already mentioned, widening of education gaps, decreased physical activity. We have some evidence that kids have been gaining weight, which could have long-term effects on their health. Kids have been less likely to go to the doctor to get regular checkups, which includes routine immunizations. Kids have been exposed to traumatic events at home. And possibly the most devastating is that many children have lost their caregivers. They've lost grandparents, parents, aunts and uncles. So we do know that the risk of serious complications from COVID is smaller in children, but that doesn't mean that it hasn't been incredibly disruptive to their lives. So that's sort of the background that sets the stage for, you know, how do we make a decision about whether we want to vaccinate our kids? What do we know about what the risk of COVID is? So what do we know about our new COVID vaccine for children 5 to 11? So it's the Pfizer vaccine. It's the same, it's made the same way. It's the same mRNA. It is a smaller dose, which is great because it means it's less likely to cause side effects. But it's the same Pfizer vaccine and it's 2 doses, 21 days apart. Here's a little bit of the, you know, if you're super interested in all the nitty gritty of the trials, Pfizer actually took more than 3,000 children and gave them the vaccine. And they didn't know they had the vaccine. It was blinded. And then they took a group of kids who got the placebo and they followed everybody for more than, it's about 2 to 3 months. So they look to see, does it prevent them from getting COVID? And they also look to make sure that there's no serious side effects. And what they found is that the kids who got the vaccine were much less likely to get COVID than the kids who got the placebo. And then they looked for any serious adverse effects that could be linked to the vaccine, and they didn't find any. They didn't have a single case. So you might see in the news that they did report there were a couple serious adverse effects. Basically the way they define it, the adverse effects just means like a kid had to go to the emergency room. One of the reasons the kid had to go to the emergency room is because the kid swallowed a penny. So they are very careful. They looked at all the medical records to make sure, is there any way the vaccine could have caused this? And then finally they concluded, no, this is just a kid who swallowed a penny, and the kid is fine. And when they looked at all the cases, they found that there was no difference between the 2 groups. There were no serious side effects, and the vaccine was very effective. Now, there are side effects. For those of you adults who've gotten it, you may have experienced the most common side effect is soreness in the arm. And kids will report feeling tired. Some kids say they're going to get a headache, but it's very rare that they actually get a fever or actually get a high fever. And in fact, it's less common than we see in the teens and adults. So Pfizer vaccine for children 5 to 11 was 91% effective at preventing COVID-19 infection. It's also really important to note that this study was done while the Delta variant was the basically the only variant that was circulating in the places where we did the trial. So we can be certain that the vaccine was effective at preventing the Delta variant. As I mentioned, we saw no serious adverse effects linked to the vaccine. And the most common side effects were pain in the arm, fatigue, and headache. And then this is a question that comes up a lot about whether or not it's safe if your child has had COVID before to get the vaccine. And so they actually looked at the kids who enrolled in the study. They checked to see if they had COVID antibodies, and a large proportion of them did. And they didn't see any increase in side effects for the kids who'd had COVID before. So we know that it's safe. So these are some slides just from the CDC that sort of hone in on why they have recommended this vaccine, why we think it's the right thing for children 5 to 11. We know that it prevents 90% of COVID cases, which means it prevents long COVID, it prevents MIS-C, it prevents hospitalization, it prevents intensive care unit stays for children, which you can imagine are very traumatic, and also prevents death. Will allow lots of more freedom for our children to be safe in school, play dates, and safe playing sports. At the same time, kids don't live by themselves, they live with their families. So the vaccine also is a good idea to prevent transmission to high-risk family members. And furthermore, also as a parent, I love the idea that my kids won't have to quarantine if they come into contact with someone who has COVID at school. So much less disruption in our ability to keep our kids in school. And so then we can keep working. And then finally, generally, we know that there's a benefit to the community to get our kids vaccinated. So that's what I'm going to say about the kids vaccine. Looks like we still have a good amount of time. I'll real quick just overview of the boosters, and then I'll make sure I leave time for questions about that. I do have a slide on the school mandates, but Dr. Hill already covered that. So the boosters, oops, sorry, too fast. The boosters are a bit confusing, and it does depend on which shot you got first. I'm going to start on the right side of the table with the Johnson & Johnson because it's simpler. So if you got one Johnson & Johnson shot, the recommendation now is that everybody gets a second shot. As long as it's been 2 months since you got the first shot, we recommend you get a booster. And for the boosters, no matter what vaccine you got the first time around, you can choose whatever you want the second time around, which sort of makes it easier. And I think for a lot of people who have questions makes it confusing. So I'll talk about that in a second. But that's the plan for J&J. If you got one, you should get a second one, everybody. For the Pfizer and the Moderna shots, the booster is only recommended for high-risk groups. But the high-risk groups actually include a lot of people. So I just want to highlight that. So if you're over age 65, we definitely recommend you get a booster. If you're over 18 and you live in a long-term care facility, or you're age 50 to 64 and have an underlying medical condition, and this includes really pretty much anything. So if you have diabetes, if you have, asthma, if you have any question of that, just go ahead and get a booster. We just want you to be protected. Same goes for ages 18 to 49 if you have an underlying medical condition. And then this is the part I want to stress is that it's also recommended if you're in a high risk profession. So that includes anyone who works in schools, teachers, other people who work in schools, if you work at grocery stores, if you work in other kind of retail, if you work in healthcare. So there's a lot of people who are included in this high risk sort of essential worker bucket. And for those folks, we do recommend that you get a booster as well. For Pfizer and Moderna, you wait 6 months until after your second dose, and then you're eligible for a booster, and you can choose any one of the three. So it is not easy to figure out which vaccine, which one you should get. If you've gotten, if you got the Pfizer, should I get the Moderna? If I got the Johnson & Johnson, what should I do? So we have a couple suggestions here. The reason we don't explicitly tell you which one to get is because the evidence is that they're all good and there's not a really big difference. So to a certain extent, if you're going to get a booster, just get the one that's easiest to get. So if you oh, I think I want to get a booster, I'm going to walk into CVS. Oh, the CVS has Pfizer today. Just get Pfizer. It's going to work. So some people have a lot of concerns about side effects. So then maybe they'll say, well, I don't like the side effects of the J&J, and that's the one I got first. So I'm going to get the Pfizer next time. That's fine. It's really up to you. If you are very confused, we recommend that you talk to your doctor. But the thing to remember is that they all work really well, and they're all safe. So this is just a picture that shows how long you need to wait if you got the Pfizer or the Moderna the first time around. And then the J&J, just a reminder, the J&J second shot is recommended for everyone, not just those special groups, and you can get it after 2 months. So this is our website where you can go to look for vaccine locations. There's a lot of different options. I was just on there today looking around for my kids, and some of the places that will vaccinate are like community clinics that have events. Then they can link you to places like Vons or CVS. And then the school systems are vaccinating. So there's lots of options. It's also a good idea to call your child's pediatrician just to see if they have the vaccine. Early on, the vaccine required special storage. So unfortunately, a bunch of pediatricians haven't set it up yet. But some have, and then that's really convenient because that's where your kid is used to getting vaccinated. All right. And then we do, if you're not into the internet, which you guys probably are because you're on a Zoom, but if you know somebody who's not into the internet, we do have a phone line that can help you as well. And you can call and they'll make appointments for you. Okay. So I'm going to start with the questions.
Dr. Morrison, I think we emailed you some questions that people had submitted prior to the event.
Yes, yes.
You might want to start with those.
Yeah.
Because they were addressing groups of questions as best as we could.
Okay. So the first questions are, how many children between the ages of 0 and 11 have died from COVID-19 in the United States? And then a follow-up question, how many have died in the school district? So I actually am going to change the question a little bit because I'm not presenting on COVID in small children tonight. I really just want to focus on 5 to 11-year-olds. That's who's now eligible for the vaccine. And as you might have seen in my presentation, we know that 94 children in that age group died in the United States. Only 1 died in Los Angeles County. I can't tell you where that was. It's a privacy issue, but we did only have 1 in the county. There's actually a lot of questions about the specifics of who dies from COVID in terms of children. And so I will tell you that of looking at those, nearly 100 kids who've died from COVID in this age group, pretty much all of them have an underlying health condition, but that doesn't mean they have a serious health condition where they were, in and out of the hospital or getting cancer treatment. Many of the kids, their complication was asthma. We know that asthma is a risk factor for COVID. And some of the kids, their only risk factor was being obese, which unfortunately we know is very common. Before the pandemic, we think about 20% of children in LA County were obese. And likely that number is now higher because of all the limitations on kids' activities. So that's what we know about the deaths from COVID that have happened. The next question was about a particular case, a student who has celiac disease, which means you cannot eat wheat, gluten, barley, and rye. And this parent was particularly concerned about the ingredients in the vaccines and whether it was safe. And I've gotten a lot of different questions about the ingredients in vaccines, especially people with allergies. So I did take a minute to look this up. There's a whole website of the sort of celiac society experts on whether the COVID vaccine is safe, having gone through all the ingredients, and they highly recommend it. So I think you can feel very good that the celiac experts have determined that there's no risk of allergic reaction, no increased risk of allergic reaction because your daughter has celiac disease. This is also true for most allergies that children have. So any kind of allergy to a food, or if your child has had an allergy to taking a particular kind of medication that's a pill, none of those actually increase the risk of being allergic to the COVID vaccine. When in doubt, definitely talk to your child's doctor, but there are very few allergies that actually mean you can't get the COVID vaccine. So can you confirm, the next question, can you confirm the recommended dosage for and type of vaccinations for children 8 and under? So I don't have any special recommendations for 8 and under. The vaccine that I've been talking about tonight is for 5 to 11. And as I mentioned, the dose it's 10 micrograms of mRNA. That's 1/3 of the dose that adults get. So next question. It says, with children mortality rates so low, especially among children with no pre-existing medical condition, why are we vaccinating our children with a vaccine that hasn't been thoroughly tested? Okay, this is a great question. I get this one all the time. Thank you so much. So the first thing here is the mortality rate being low. So you're correct. The mortality rate for children is definitely low. And as I mentioned, the kids who passed away from COVID all had underlying conditions, though not all of those underlying conditions were rare things. But we don't just recommend vaccines because they kill children. We recommend vaccines because they can make children very sick. So as I mentioned, we are very concerned that a large number of kids got hospitalized with COVID. About a third of the kids who are hospitalized with COVID have no pre-existing conditions. It's, you know, for me as a mom, I think like, would I prevent my kid from having to stay in the hospital by getting this vaccine? And for me, I absolutely would. I do not want my little kids to have to stay in the hospital. Some of those kids were in the intensive care unit. There's also the possibility that kids can get long COVID, which can be debilitating for months. And then, as I mentioned, the multi-inflammatory syndrome in children. So we don't just recommend vaccine because of how many kids they kill, how many kids the disease kills. We look at the whole picture. And in fact, we give our kids a lot of vaccines for things that are much less likely to kill them than COVID, like hepatitis A and meningococcus. So it's a complicated risk benefit, but there's all these things saying like, you know, I'm really worried about my kid getting in the hospital or getting these like months of symptoms or this very dangerous inflammatory condition. The second part of your question, though, is why are we recommending a vaccine that hasn't been thoroughly tested? So that's a really common question because we've never been through a pandemic before, and we've never seen what all of the resources of our scientists and our government can do to come together to make a vaccine that's safe, but still make it quickly. And there's a couple questions about this, so I want to spend a little time on this. None of the steps were skipped in making sure that this vaccine is safe. So it came out quickly, it's true, but it's not because we skipped any steps. It's because of a couple other things, mostly because it was a pandemic. So there was a lot of attention. So in the past, when we've come out with a new vaccine for kids, it will take years to enroll enough people in a study who are willing to help us to figure out if the vaccine works. And so then it takes years to approve the vaccine because you can't get families to agree. With COVID, we had thousands of families who were willing to participate, and we were able to get, 4,500 kids enrolled very, very quickly. And that's one of the reasons that we were able to see quickly that the vaccine was effective. But the FDA did not skip any steps in how long they follow kids after they get the vaccine to make sure that there's not serious side effects. So in any of the vaccine trials we do, because of the way vaccines work, any effect that you're going to see is going to happen within the first couple of weeks. So the longest effect we've ever seen was 6 weeks. So the FDA's rule is you have to follow a kid for at least 8 weeks after they get a vaccine to make sure that it's safe. And several thousand of those kids were followed for 3 months to make sure we didn't see any serious side effects, and we didn't see any. So that's very reassuring. So it did happen fast, but the reason it happened fast was we got lots of kids within the trial. It's not because we didn't follow them we always follow kids for that 2-month period after they get the shot to make sure that we don't see serious effects. So next question, there's some questions along this theme too of what will be different once we get the vaccine, once the kids get the vaccine. So if the kids and the staff have all been vaccinated, will they no longer be required to wear masks? And if they still have to wear masks, why? So we I think we should all be very hopeful that if we can get all the kids and all the staff vaccinated, that we will be able to stop wearing masks. It depends on a couple factors, because we do know that if there's a lot of unvaccinated people in the community, then COVID is still going to be traveling around, and we don't want to put people at risk for whom the vaccines don't work, like people whose immune systems are really, really low. We got to protect those people. But I think there's a very good chance, if we can get all of our kids vaccinated and all of our staff vaccinated, that it will be safe to be inside without masks on. Now, is it going to happen right away? No. We don't even have enough adults. You know, we were hoping, if you'll remember, in the summer, the state took away the mask mandate because we were hoping that we had enough people who were getting vaccinated that it would be safe. And then the Delta variant came, and we don't have enough people vaccinated to keep us safe from the Delta variant without masks. So we've sort of had to take a step back. But vaccinating our kids is going to get us definitely a lot closer to where we want to be. So I'm okay. Next question. What percentage of children in clinical trials for the vaccine suffered adverse events? And what were the adverse events? So as I mentioned, there were no adverse events that were linked to the vaccine. So they saw a couple of those signals in both groups. There were actually more adverse events in the placebo group than in the vaccine group. But when they looked at whether it made any sense, as I mentioned, it was like a broken bone, someone swallowed a penny. And these are the kind of things you can only see in kids' vaccine trials, hopefully. But so there were actually no serious adverse effects in either group. And in terms of non-serious adverse effects, we do see, the non-serious side effects, like a sore arm. It's pretty common. Like 70 to 80% of kids would report a sore arm. And then things like fatigue and headache, they were also pretty common. Maybe half of kids would say they felt tired. It was less for headache. The good news is the numbers for things like fever and chills, which we saw fairly frequently in adults, is much lower in kids, probably because they're getting a smaller dose of the vaccine. Another person is asking specifically about the COVID infection fatality rate. And I do not know the exact number for that. I think the general idea, that's like, of kids who get infected from COVID, how many of them are going to die? The number is very, very low. This goes back to what I was saying before. If that was the only reason that we recommended vaccines, then we wouldn't make this recommendation, but it's not. We know that any death of a child is any preventable death of a child is a tragedy. So we don't want to see any of those. And then we also have really good evidence that the vaccine will prevent those other potentially quite dangerous things, like being in the hospital, having long COVID, or having the inflammatory syndrome. So there's one question about, it's about the school mandate, which I can't really answer, but inside the question, it's asking about whether kids can still contract and spread COVID if they get vaccinated. And I think sort of saying, well, if that's true, if the kid can still contract COVID and the kid can still spread it, what's the point? Which is a really good question. I like these questions because we're all being super, super careful with our children. So when we first got the evidence from the vaccines for adults, they didn't really check and see if people could still get COVID but have no symptoms. They didn't know if they could still spread it. Now we have a lot more information. And unfortunately, mostly because of the Delta variant, we've learned that people who get vaccinated, they can catch the virus and they can spread it. The good news is they're much less likely to catch it. So we can see in Los Angeles County, I didn't show you those slides, but we have these figures that show of the people who are testing positive right now, the vast majority of them are unvaccinated. So people who are vaccinated are testing positive, but your risk of testing positive is much, much higher if you're unvaccinated. So you're much less likely to get COVID, which means you're much less likely to spread COVID because you didn't get it in the first place. Now, if you've already gotten it and you're vaccinated versus unvaccinated, we don't have good data on whether you can spread it better or worse. We do know that you can spread it. But because we know you're less likely to catch it, there's still a very good argument that the vaccine helps slow the transmission in the community and protect all of us. Let's see. Well, the next question is similar, so I'll skip that. So somebody has brought in some really important data from our vaccine adverse effects reporting system, which is called VAERS, V-A-E-R-S. This is a tool that the CDC uses to follow vaccines once they get out, and millions of people are getting them. And I actually worked on the team in LA County where we reviewed every case that's in VAERS to see if there was anything that made us think that the vaccines were more risky. So there's been a lot of attention paid to once the vaccines were rolling out to millions of people. And the Pfizer vaccine, by the way, is it's like 250 million people have gotten the vaccine now, 250 people over the age of 12. The only risk that we have seen was more common than we saw in the studies was a risk for heart inflammation in teenage boys and young adult men. And so that VAERS system is really helpful. And this was a big concern of the CDC because we saw that afterwards. Now they went and they looked at whether it made a difference in terms of recommending the vaccine. And what we see is that the heart inflammation, that it's a very, very rare side effect. It's like 54 cases per million vaccines. So your chances are 54 in a million of getting this heart inflammation. Everybody who's gotten the heart inflammation has gotten better, and they get better very quickly. And the alternative is that we also know that there's a lot of heart inflammation and complications that come from having COVID. So in fact, you're much more likely to get heart inflammation from having COVID. And that kind of heart inflammation doesn't necessarily get better quickly or go away. So the VAERS system was a big part of raising that to our awareness. Then it was investigated. And then the CDC and Pfizer paid very close attention to this with the younger kids, which is why they added several thousand kids to the study. So it took a little longer. And they saw no cases of heart inflammation in the study group. So they found that reassuring. Okay. I think I got through most of these.
Dr. Morrison, there was a question about the how long the antibodies last in somebody who's had COVID and the argument for them getting a vaccine. I think you kind of touched on it, but if you could talk about.
Yeah, let me go back to that one. That's a really good question. So you guys have very, very, very good knowledge of how the immune system works. I'm really impressed. We know that when you get a COVID infection, your body produces some antibodies. And early on, we were really hopeful that that meant everybody who got COVID couldn't get it again. Unfortunately, it doesn't work that way. We do know that most people produce some antibodies, but it's super variable. So if you have a mild case of COVID, which is what most kids have, then you often can have very low levels of antibodies and it goes away very quickly. And so your antibodies tend to be higher if you've been very, very sick, but even then it's sort of different from person to person. So we've been really interested in what's the difference between the immunity you get from having COVID versus the immunity you get from the vaccine. And we're starting to get a bunch more information about that. So there was a really good study that came out that looked at tens of thousands of people who'd had COVID once versus tens of thousands of people who'd never had COVID and got the vaccine, and found out that the people who'd had COVID before were 5 times as likely to end up in the hospital with COVID. So that was very compelling evidence that the vaccine is better than just what our body does to a COVID infection. And I think that's important. I mean, we get a lot of mixed signals from medicine sometimes, like doing it yourself is better and keeping yourself healthy. And I think there's definitely times in the past where Western medicine has messed things up by trying to intervene. I think a great example is formula for babies. We thought, oh, science is making this brilliant thing that's better than any breast milk. And then it took a while. We figured out, no, it's not. It's not better than breast milk. So I definitely love those questions. Like, isn't what our body does smarter? Isn't natural immunity better? And there are cases when our bodies are smarter than modern medicine, and this is not one of them, unfortunately. We have really good evidence that the response to a COVID infection is just not reliable, but the response to a COVID vaccine is very reliable and will protect you from getting very sick if you get it again, from dying, from being in the hospital, and those other complications for kids. Anything else I missed you want to highlight, or should I jump into the Q&A here?
There was also a question about emergency authorization versus full authorization and what the difference is in that.
Yeah, that's a great question. The emergency authorization just takes out a couple of the long-standing, more bureaucratic steps of total FDA authorization, allowing it to happen faster. So it's just the authorization is faster, but as I mentioned, the 3 phases that make up whether the vaccine is safe, whether the vaccine works, whether the vaccine is safe and works in thousands of people, those 3 steps, nobody gets to skip them. They're all part of the emergency authorization. And then to go from emergency to the full authorization, then they have some documentation, they have to do some specifics of the manufacturing, and then they have to sort of follow it for slightly longer in a larger group of people.
The other question we received quite a bit was concerns about how the vaccine might impact fertility long-term. I mean, I don't know if there's information yet on that.
Yeah, so that is a really unfortunate rumor that has no basis in science. I totally get why people are scared. As a parent, I am always, I'll always double check. I mean, I'm a parent, I'm a doctor too, but still, if I'm going to give my kid Tylenol or ibuprofen, I'm like, wait, let me make sure this is safe. Let me make sure I'm giving them the right dose, because we have this idea that you can do something in the short term, it can have really long-term effects. So that can be true of certain medications because of the way that medications work. But that is not true for vaccines. We do not have any vaccines because of the way they work. They go into your arm, and then they trigger your own body's immune system. And then the actual vaccine, the mRNA, is gone within a day or 2. Your body breaks it down. So all that's left in your body is your own immune reaction. And that does not have long-term effects. We have never seen that. So the idea that a vaccine could cause fertility, we've never seen it with any vaccine. I can't even think of a way that it's possible. But the idea that we want to make sure that we don't do anything that has long-term effects is a really good question. And it's just a difference between vaccines and medications. Medications you can take a medication now and then you can see an effect, sometimes even 10 years from now, but that is not true for vaccines. We have no vaccine that's ever had an effect like that. Like I told you, the longest we've ever seen is about 6 weeks after a vaccine. And that's why all the studies last at least 8 weeks. So we make sure we don't see anything. And as I mentioned in this one, we did not see any adverse effects. So I'll look, I can pull up the Q&A and see if there.
And we have several questions in the Q&A. Dr. Morrison, if you can try to go through some of those. If we do not get through all of them, we will work with Dr. Morrison to get answers in writing, and we will post on our website after this webinar.
Okay, yeah, it seems like there's a lot of concerns about the.
There was a question about the upcoming holidays. I've heard questions about travel recommendations for unvaccinated individuals. I know that's not pertinent to the vaccine piece exactly, but I have heard a lot of questions about that and wanted to know if you had any recommendations.
Oh yeah, I'm sorry, that wasn't the question somehow. I missed that. So the question was about whether the travel recommendations were different based on whether you are vaccinated, which they are. So if you're vaccinated, we don't have the same recommendations that you need to quarantine after you travel outside of the state, because we know that you're very well protected by the vaccine. So for kids traveling over this holiday period, kids 5 to 11, they're not gonna be fully vaccinated in time, but by the new year they will. And then there's lots of things that get better. As I mentioned, right now, if you have a kid test positive in a classroom or in a small pod, then all the close contacts need to quarantine because they're not vaccinated. But if your child gets vaccinated, then they don't need to quarantine if they're exposed. So that leads to, less disruption in your life. Your kid gets to keep going to school. Same thing for participation in sports, which kids are finally getting back into. So there's a lot of pluses to being vaccinated. So there's a lot of questions about different side effects or different consequences of the vaccine. And this is where it is really tough because there's a lot of rumors flying around and media stories, especially things we see just a headline, that I want to try to reassure you that the vaccine has been very, very extensively studied, especially in adults right now. As I mentioned, I was part of this team where we look into every case that's reported that it looks like the vaccine caused a serious adverse effect. And we really have not seen anything that warrants not getting the vaccine. As I mentioned, there's those cases of heart inflammation. There was some increased risk for blood clots, but the risks for COVID remain so high that even when you take into account those teeny tiny risks of an adverse effect from the vaccine, it still is a really good decision to vaccinate for COVID. So people will, tell stories like I heard about somebody who got vaccinated and then they died. And we investigate every single one of those cases. And the truth is there's just so many people getting vaccinated And remember, early on, so many of the people getting vaccinated were our most vulnerable people who were quite old. So there are people who get the vaccine and then a couple of days later they pass away. But when we look at the cause of death, it's not related to the vaccine. We've seen no evidence that the vaccine increases your risk for death. There have been huge studies that look at whether or not you're likely to die after the vaccine or not after the vaccine, and it doesn't increase your risk for dying. And of course, we know that for adults, the vaccine greatly reduces the risks of dying from COVID. So I really appreciate all these questions about safety. There's a lot of information there. I know you guys are trying to keep things.
Dr. Morrison, there's a
Yeah.
couple of questions about myocarditis and just heart inflammation. Can you talk more about what the data is saying about those conditions?
Yeah, so that was sort of everyone's concern because we have seen that there is an increased risk in teenage boys and young adult men for myocarditis after the Pfizer vaccine. So they looked very closely at all those cases. There were no kids who died of their heart inflammation. In fact, all of them got better quite quickly. But in that age group, teenagers and young adults has the highest rates of heart inflammation of any group. So younger kids in general are less likely to get heart inflammation. But just in case, the FDA required that Pfizer add an extra 1,500 kids who got the vaccine and follow them to make sure they didn't have a high rate of myocarditis. And they found no cases of myocarditis. So if the Pfizer vaccine is linked to myocarditis in younger children, it's very, very rare. So we know in teenagers, it's about 54 cases per million. So it would be lower than that. For me, I just have to remember, sometimes when you're thinking about the risks of the vaccine, you're thinking about, I'm gonna either give them the vaccine, which has small risks to it, or I'm gonna give them nothing, which has no risk. But that's not the choice we're making as parents, because the truth is, I would love to say I can keep my kids safe from everything, but I don't want them to have to stay home all the time. So I want my kids to be in school. I want them to be playing sports or music or art class. I want them to be having play dates. And if that's the case, then they are at risk of getting COVID. So the decision for me as a parent is the vaccine riskier or is getting COVID riskier? And I feel very comfortable saying that the vaccine is much safer than getting COVID. There's unknowns. It drives me crazy as a parent. I just wish I knew what was going to happen. I wish I could protect my children from everything, but I can't. So I just have to make the best decision I can. I've looked at this information really closely. And when I look at the risks of COVID and the risks of the vaccine are so much smaller. The risks of COVID is really, really scary. So it makes sense to get the vaccine.
Along those lines, I don't know if you had a chance to see any of the video on Senator Johnson's panel. And so there's concerns in the chat about vaccine mandates and vaccine injuries. Can you elaborate more about the risk between the COVID vaccine versus getting COVID? And I don't know if you saw the panel or can speak to that.
No, I'm sorry, I'm not familiar with the panel. The risks of COVID versus the risks of the vaccine, I think that's the sort of main message that I want you to go home with. If you have a kid who has a pre-existing condition, even if it's asthma or being obese, then there is a risk of dying from COVID. And it's a small risk, but it's a risk. There is no risk of dying from the vaccine. So those are sort of two sides of that equation. Now, if you have a kid who's healthy, they have a almost no risk of dying from COVID, but they do have risks of all these other complications like being hospitalized, being in the intensive care unit, having the inflammatory syndrome, having long COVID. And the risks of the vaccine are either very mild or very, very rare. So that's how I make the decision.
Thank you. And I know we are approaching 7 o'clock, and we do have a number of questions still in the Q&A. Again, we are going to work with Dr. Morrison to capture these questions and write them up. So if you still have a question that you haven't been able to ask yet, please put that in the question and answer. One question I haven't seen before, it's an interesting one. It's for 13-year-olds. I don't know if you know this. They're wondering if they could do, or 12-year-olds, 13 or 12-year-olds, are they allowed to get the 5 through 11 child dose instead of the 12 and older?
Yeah, there is actually a really common question about what to do about 11-year-olds and 12-year-olds. There's some people who want their 12-year-old to get the kids dose, and there's some people who want their 11-year-old to get the adult dose. So what we know, so the doses are not so much based on like how big a person is. They're based on what we know about the development of the immune system. So kids actually have really awesome immune systems. I mean, you can imagine they have a lot of germs, so they're germ fighting machines, and their immune systems respond really well to vaccines. And that's part of the reason that the lower dose works for younger kids. Now, as you get older, your immune system doesn't work as well. And so you need a little bit more instructions to get it working. So right now, we don't recommend that you pick a dose that's outside of your age group. They've been studied in those age groups, and the safest thing for a 12-year-old is to recognize that they probably have about a 12-year-old immune system, and they may need a higher dose. And then the questions that come up about like, what if you were 11 and then you turn 12 between your two doses, then things get kind of complicated. But the recommendations are actually the same. You just get the dose that's indicated for your age, even if you get a first dose is low and the second dose is high.
Well, thank you, Dr. Morrison. Really appreciate all the information. I know, as you mentioned, you're a parent, I'm a parent as well. And so as we make these decisions, we want to have as much information as possible. I want to thank everyone for participating this evening. Please ask your questions in the Q&A. We will capture those questions, and we will post them on the website with the answers. We also will post this video to our website. This is important. And again, right now, BUSD does not have a student vaccine mandate. We're following the state mandate timeline, and they're following it based on full FDA approval. Right now, it looks like that will not happen until July 1 of 2022 for the older students, the 12 and up. We don't know when full FDA approval will be for ages 5 through 11. But it's important for all of us to do our research, to talk to our medical providers, and make the decision that's best for our students right now. I mean, based on the information, we can see that vaccines are very safe. We know the dangers of COVID, but we have to do our own analysis as parents and make that decision right now ahead of any mandate. It is important. I do want to remind everyone, based on the conversation that was in the chat, the holidays are approaching us. Many more people are going to be traveling. We need to make sure we continue to wear our mask. We continue to follow all the protocols that we've been using inside school and outside of school so that we can make sure our students are healthy in our classroom. But again, thank you, Dr. Morrison. Thank you, Ms. Aguilera. Thank you, Ms. Cashman, for pulling this together. Thank you to our translators, as well as Ms. Dressler. We wanted to have as many forums and conversations as possible and get the information out there. Thank you all, and have a good evening.
Thank you.